Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today's topic is something that millions deal with, but few really understand. Seborrheic dermatitis. That's a mouthful. Is it just dandruff? Is it an allergy? Or is it something deeper? We're going to get to the bottom of this seborrheic dermatitis. With me today is Dr. Bryn Henderson, a board-certified physician and medical innovator who brings not just clinical experience, but a deep understanding of holistic and regenerative care because he's done it in his own office. So, welcome back, Dr. Henderson.
Thank you, Dr. Pinsanti. I'm glad to be here. Seborrheic dermatitis is one of the conditions that can look like a small issue, but for many people, it has a big impact. So let's dive in.
All right. What exactly is seborrheic dermatitis?
Seborrheic dermatitis is a long-lasting skin condition that causes red, itchy patches with greasy, yellowish flakes, and most often on the scalp, the face, and upper chest. Think of it like a supercharged dandruff, but it can also affect other parts of the body, and it tends to come and go. While it's not dangerous, it can be very frustrating and embarrassing.
Can you catch it from someone?
It can happen to anyone, but we see two peaks. One in babies, it's called cradle cap, and the other in adults, especially men between adolescent and middle age. And it's more common in people with certain conditions that impact their immune system, like Parkinson's, HIV, and it tends to flare up in cold, dry climates.
Okay, so is it poor hygiene?
It is not caused by poor hygiene. The main culprits are oily skin, stress is a huge one, and changes in weather, and a type of yeast on the skin. For some, genetics and the immune system also play a role. People with certain gene mutations or immune responses may react more strongly to the yeast, causing inflammation. The most common of these symptoms for seborrheic dermatitis, the most common ones are red skin, greasy flakes, itching, and sometimes a burning feeling. It's on the scalp often, and it can look like dandruff. On the face, you'll see patches around the nose, eyebrows, ears, and sometimes even the chest and upper back.
So what's the usual way that you diagnose seborrheic dermatitis?
Diagnosed by just looking at the skin. The pattern of the redness, the scaling is pretty distinctive. In rare cases, we might do a skin scraping or even biopsy to rule out other conditions. But most of the time, it's evident by its appearance.
All right. So what's the first treatment that you would do in your office?
The first line of defense is to get an antifungal. You start with the shampoos on top of their head and use something like ketoconazole to help reduce the yeast. If there's a lot of inflammation, we might even use a mild steroid for a very short period to stifle the itching. For sensitive areas like the face, we do not use steroids. We use moisturizers to help reduce the flaking and irritation.
All right, let's talk about some real cases you've had in your office. Take us down that storyline.
Okay. All right, that's nice. We had a 34-year-old software engineer who came in complaining of persistent scalp itching and flaking. He also had redness around his nose and behind his ears. His symptoms got worse with stress and cold, and we started him on ketoconazole shampoo and a light steroid cream that was over the counter. Over time, he improved, and we switched to maintenance therapy and lifestyle adjustments.
Does this ever go away?
Unfortunately, no. Your response, your triggers are innate, but it's easily controlled, and hope springs eternal.
Yeah.
Hope springs eternal. So it is chronic, but that doesn't mean you have to live with it. With the right treatment plan, and if you stick to it, it's very well controlled. Remember, so much of this is genetic. So they have a significant amount of methods to control it.
Oh,
So even the fatigue with the hormonal changes or poor diet can play a huge role here. It's about managing both the skin and a big part is the lifestyle.
so now let's go to advanced treatments people should know about.
Roflumilast is a foam and a new FDA-approved steroid-free foam, and it's had very, very good results. We've combined it with platelet-rich plasma, which uses your body's own blood and reduces the inflammation and helps heal with growth factors and new blood vessels. In tough cases, we even have to explore using stem cells, and especially if the ability to heal the skin barrier and regulate oil gland needs improvement.
All right, so I've heard some patients try natural options.
Oh, absolutely. Tea tree oil, aloe vera, diluted apple cider. There's all kinds of things for mild symptoms. Even fish oil supplements can reduce flare-ups due to their anti-inflammatory process. But it's important to talk to a physician before trying any of these, especially on sensitive areas of your body.
All right, you mentioned lifestyle. What should a person with seborrheic dermatitis do?
A person should begin with sleeping properly. They need to allow their body time to heal. That's the only time your brain cleans itself is when you're sleeping. So you get a good night's sleep and you hydrate the daylights out of yourself. When you void, which is fancy word for pee, you should have clear urine, and then you move into the stress area. Using gentle skin products, you keep the skin clean and moisturized.
So does seborrheic dermatitis lead to other problems?
Absolutely. If left untreated, it can lead to skin infections, especially from scratching. It can have an impact on your mental health too, because people get embarrassed and they won't even go outside because they're anxious that somebody's going to see them.
So Dr. Henderson, what's your advice to patients living with seborrheic dermatitis?
My message is simple. You can absolutely control this condition. It might not be curable, but it's very manageable. The key is consistency. I like to teach patients the seborrheic plan. It's a comprehensive but easy to follow guide for daily care and flare-up prevention.
All right. What does the S stand for?
Shampoo with medicated products. Use ketoconazole or selenium sulfide or zinc-based shampoos 2 to 3 times a week.
So that's not daily.
That's true.
You're not allowed to use the ketoconazole shampoo daily.
You have better results if it's 2 to 3 times.
Okay. E
is ease that inflammation. Apply the topical steroids, mild ones, or antifungals to reduce redness and itching.
B.
Be gentle with your skin. Use fragrance-free cleansers and avoid scrubbing.
O.
Oil control. Clean oily areas like the scalp, nose, and ears regularly.
R.
Rinse thoroughly. Always rinse off products completely to prevent buildup.
R.
Another R, reduces stress. And boy, that's a big one. Stress is a major trigger. Manage it every day with mindfulness or exercise.
H.
H is hydrate your skin. Moisturize with a cream to prevent flaking.
E.
E is establish a consistent routine. Stick to a skincare plan even when symptoms subside.
I.
Identify triggers. Track the flares and note the environmental or lifestyle changes.
C.
Consult your physician for medication adjustments, or if symptoms worsen, you'll need a plan. Patients feel more in control and have confidence. Plan makes a huge difference.
Well, thank you, Dr. Henderson, for being on Doctor to Doctor today. Seborrheic dermatitis may not be life-threatening, but it can certainly be life-altering. The good news, with the right mix of science, self-care, and support, it's something you can learn to live with and live well. Thank you for shedding light on this common but often misunderstood condition. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.